I am in awe of the report out of the first group. Thank you. Wonderful. Don't blink because you may miss my report out. Paradoxically, the very first comment that was made in our group probably works out to the strongest observation from our group. And that first comment was, hey, all that CMS data from Medicaid, where can we get some? Why isn't it available? Why isn't it cleaned up? And why isn't it accessible? Now, that was the first comment. Where we ultimately got to, the strongest observation and finding of our group was, there is a lot of data being collected right now, and we don't know the half of it. We don't know the third of it. And we really need to pay more attention to what exists, to what's there. This includes federal partners and programs, whether it's Maternal and Child Health Bureau. It includes the White House and the drug-free communities. It includes grants that SAMHSA is funding. All of these have data that could be made available, that probably should be, that we ought to be knowledgeable about. Another important source of data comes from contextual information. Again, risk and protective factors are such an important part of our field and what we need to know about. There is, I'll characterize it as unconventional data for our field, but there's a wealth of information about communities down to counties, cities, census tracts about from economic census and from the housing census and from the population census that, again, we haven't looked at nearly carefully enough to think about how we can use it. There are some unconventional partners out there that we should pay attention to. Zillow was mentioned, and they said if you go to Zillow and you are interested in a house, dial it up and they can tell you all kinds of things about the neighborhood, the community, the zip code, the census tract, the schools, the crime rates, the property values, taxes, just a host of very meaningful contextual information. Granted, it's not a specialized set of measures that the first group was talking about. And certainly our group did recognize the need for better measurement of well-being, recognizing that so often in our field we're measuring pathologies, problems. A real need to pay attention to the measures of what's going on well, so that we're not just characterizing, as I said, pathologies and problems. So really our group talked a great deal about how can we use what we have better? How can we better understand what exists? We need to pay attention to that. We need to look across federal agencies to inventory, to compare, to identify, and to think about cross-referencing so that the community assessments from drug-free communities can be made available. We need to be careful that when a grant from MCHB goes in, one from SAMHSA, another one from another area, that there is some cross-referencing, that you don't just keep reinventing the wheel in terms of the data and the measures that are being used. There is a lot there, and we really should take some time, step back, and try and count it. There's wonderful work being done to develop new and improved measures. Let's make sure that we tap into what we already have, and so that we can do that efficiently. And then when we have the better measures, that we can link those to it. Almost at times it was that we've got a wealth of data and we're not capitalizing on it. So data is often collected in studies, and certainly researchers know that, whether you're NIH funded or otherwise, and all too often the bulk of your money goes into data collection and there's not enough left over to do the analysis, and that's true with a lot of these other things. So Hendricks was saying we need to enable communities, coalitions, whatever, with resources to do more analysis and to make sure that the money goes towards analysis instead of, again, just collecting new data. Enabling them with use or lose money. Analyze and report, learn about what you're doing, in contrast to reinventing the wheel. That's one thought and one observation. Again, the theme very much was, how can we capitalize on what we have and make sure that we know what we have as well as we can so that we can build and move ahead. I think I'm going to probably take it to there. And that really, like I said, the first comment really segued into the real theme of our discussion. We talked about the other issues, the gaps and the so forth, but it really comes down to, let's, you know, we can do some additional homework. It needs to be done so that we understand from child trends or from MCHB or wherever else what is there, and we can build upon it. Okay, thanks.